Ketamine and dissociation. What is dissociation, and do I need to dissociate for ketamine to work? So this is a question I get frequently asked is, do I need to dissociate to make my ketamine therapy work better? And for a lot of people, the whole concept of dissociation is quite a scary thing because it just seems like such a freaky thing to have happen during an infusion that you separate your consciousness from your ability to sense or feel or move. So, dissociation has been defined as a discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. So, what do higher doses of ketamine feel like? Generally speaking, in the treatment of mood disorders, we use sub-anesthetic doses of ketamine, which are generally 0.5 milligrams per kilogram over 40 minutes. Now, at higher doses of ketamine, which can be used in some instances of individuals with mood disorders who prefer to dissociate, or in anesthetic situations, what exactly do those dosing feel like? So a lot of individuals, when they receive the higher doses of ketamine, feel like they've been disconnected from their environment. For some, they get what's effectively what they consider an ego death. They feel like they're dying, passing into another existence. These are altered states of consciousness and altered awareness of the self, environment, and reality. Each person has a unique experience that is frequently noetic, meaning that there are no words to explain or describe their feeling. For some individuals, as they get into higher dosing of ketamine, they'll notice paranoia or looseness of associations or ideas of reference or just unusual thought content. Sometimes the paranoia can be quite severe for these individuals at extremely high doses. There can also be feelings of detachment from the surroundings. We call this derealization. And there's also the feeling of detachment from the self, as in depersonalization. For some individuals, they feel like they are floating away, that they're in space and kind of stretching and connecting with the environment. So individuals will have altered perception of the body, environment, and even in time. They feel like they've been there forever or only for a short period of time. So there's definitely a loss of sense of time perception or time distortion. Now, for what we generally use in mood disorders, we use lower doses of ketamine. And these are sub-anesthetic doses, meaning that the individual is effectively awake, although a little bit altered. These doses are 0.5 milligrams per kilogram over 40 minutes. And this is based on ideal body weight. So if the person is morbidly obese, we take their heights and convert that into a BMI and effectively calculate a dosing on that. Now, during this period of the infusion, individuals may feel a little bit spaced out or dreaming or some other alteration in consciousness, but it can be mild, especially on the initial dosing. Now, there are differences in the way that people experience this. If they are not depressed versus being depressed, the experiences can be completely different. Generally speaking, we are treating depressed patients. So these individuals have kind of an experience as we're describing now. Now, the main side effects of a ketamine infusion are primarily nausea and vomiting. And for this, we will generally prophylax patients with medications for this, such as Zofran or ondansetron, Phenergan, otherwise known as promethazine or compazine. Some individuals may get a mild headache or dizziness, vertigo, elevated blood pressure, blurry vision, or coordination and balance issues. And this can last for generally up to 1 to 2 hours maximum after an infusion. The majority of symptoms, though, are gone within minutes after the infusion is stopped. So the altered states of consciousness with ketamine are varied, and they change from infusion to infusion. Generally speaking, we tell individuals that they don't have to have a great infusion experience in order for ketamine to work for their mood disorder. Most of the time, people find the infusion experience to be absolutely fascinating and amazing. But for other ones, there are some cases where they get a little bit anxious or they get a little bit frightened. And so it is possible that a person can have a great experience one time and not such a great experience the other time and still get fantastic antidepressant effects. Now, the dissociative side effects noted by individuals with depression include feeling strange or weird, spacey, woozy, floating, or loopy. There is generally an alteration in their perception of their body, environment, and time. There will be unusual body sensations like tingling and heaviness in their face and hands, difficulty speaking, and for others, there's peacefulness or disinhibition or connectedness to the world. So, as far as the ketamine experience, there's always initial numbness and heaviness in the face and arms. There is, of course, a dissociative component to this, as ketamine is a dissociative anesthetic, and meaning that the ability to sense and move and perceive is changed and disconnected from each other. Many individuals will have visual distortions with enhanced colors and shapes, and for others, there's alterations in auditory perception, feelings of floating, bizarre thoughts, or feelings that they're shrinking or enlarging or stretching. And others will have sensations of synesthesia, where they can taste middle C and feel the color green or hear the color red. And these all represent basically areas of the brain communicating with each other that generally don't speak very much together, such as sound and taste and sight. And the ability of the brain to do this is very helpful in mood disorders because it effectively helps get rid of cognitive rigidity. Cognitive rigidity is fixed thinking, fixed ideas, and the inability to see outside the box and to think of new ways to cope with problems or come up with new strategies when confronted with difficulties. And cognitive rigidity is something that's very common in individuals who are depressed. There's a tendency to become more cognitively rigid. And so studies have demonstrated that with certain psychomimetic drugs, such as ketamine, that there are basically crosstalk between areas of the brain that allow an individual to become less cognitively rigid. And this actually helps out with psychotherapy. So the big question is whether there's an association between dissociation with the ketamine experience and enhanced antidepressant effects. And there's two schools of thought. Of course, one is that you have to dissociate in order for ketamine to work, and the other one is that it's not necessary to dissociate. Do you need to dissociate to get the effects of ketamine? Well, there's a number of studies out there, and they vary on the answer. Initially, in 2014, Lukenbaugh and others had done a study in which basically they evaluated 108 individuals. They found that none of the vital sign changes affected the outcomes or improvement of depressive symptoms. And they used something called the Clinician-Administered Dissociative State Scale, the CADSS, which is a measure tool, a medical tool to evaluate a person's dissociation during ketamine infusions. And they found that there seemed to be an association between the CAD score, or dissociation, and the antidepressant improvement after ketamine infusions, both at 230 minutes and 7 days post-infusion. So from this study, they said, yes, dissociation does make ketamine work. So further questions have been, do I have to float in order for ketamine to work? And this has also been evaluated in a study by Acevedo Diaz. And this particular study happened in 2020, in which they evaluated the question of floating and whether it predicted treatment responses to ketamine. What they did is they pulled data from 3 double-blind crossover placebo-controlled ketamine trials in which 82 participants were treated. And they were basically treated with the usual 0.5 milligram per kilogram infusions. And they noticed that the ketamine definitely improved the depression through the MADRS score, which is a measured, medically validated tool to basically document improvement or worsening of depression scoring. They noted that there was no relationship between floating and the MADRS score results, either at 230 minutes or day one post-infusion. So floating, which is a depersonalization side effect, did not mediate antidepressant response to ketamine. So this is an example of dissociation not being associated with depressive responses to ketamine. So as time passed, the question of dissociation being necessary for ketamine to work was high on the minds of a number of investigators. In a research paper by Dr. Mathai and others in 2020 demonstrated through a systematic review that effectively there was no correlation between the antidepressant effect of ketamine and its psychomimetic effects. And what they did was they found 8 papers out of some 56 papers that they found with ketamine infusion therapies that had what they felt were appropriate measurements of dissociation. And the measurements they used and looked at were the CAD score, the Clinician Administered Dissociative State Scale, and something called the Brief Psychiatric Rating Scale, and the 5-dimensional Altered States of Consciousness Rating Scale. And they took these and evaluated them in 8 separate papers that they found. And again, they only found a 37.5% correlation between dissociation and antidepressant changes. So basically, you do not need to dissociate to have ketamine work as an antidepressant. So it is possible that maybe the scales we're using are wrong and they don't actually assess what's really going on or encompass the ketamine experience, that maybe we need to look at other concepts such as the blissful state feeling, the experience of unity, or the spiritual experience or disembodiment that may better explain, correlate to ketamine's effect in its dissociative experience and the results. Well, this is something where further work will be needed. So basically, when you look at ketamine and ketamine infusions, ketamine affects depressed patients different than non-depressed individuals. So if you're not depressed and you take ketamine, you'll feel different on ketamine than if you're depressed. And a study by Nugent and others demonstrated in 2018 that there are different behavioral effects in depressed and healthy individuals. And in this randomized double-blind placebo-controlled crossover trial, they basically looked at treatment-resistant depression patients, of which there were 35, and healthy volunteers, of which there were 25, and treated them with ketamine under the same conditions. And they noted that the healthy volunteers had actually a brief increase in dysphoric symptoms, meaning just kind of feeling bad overall, even though their dissociation was the same as the depressed patients. And so actually the depressed patients felt less depressed, and the patients who were normal actually felt a little bit blah, just kind of gross. And so what the overall results of the trial showed was that basically the divergent responses that healthy controls had demonstrated that dissociation is not really related to the outcomes of ketamine therapies, as everybody dissociated in this trial. So dissociation and ketamine results are poorly associated. So the whole concept of getting into the K-hole for ketamine to work is really invalid for most people, it seems. And this was also evaluated in another observational study, which basically used treatment-resistant patients. And although this particular study used 49 inpatients with major depressive disorder and bipolar disorder, and they all received 8.5 milligram per kilogram infusions of ketamine at 40 minutes each, in addition to their usual care of pharmacotherapy. This one also noted that there was no association between dissociative symptoms and the treatment outcome, meaning that the CADS, or the BPRS scoring, which are measurements of dissociation, had absolutely no association with treatment outcomes. It also demonstrated that ketamine was extremely safe and that it was highly effective in basically its antidepressant effect in these severely depressed individuals for whom nothing else seemed to be working. So the study effectively demonstrated no support for the association between dissociation and treatment outcomes. So effectively, dissociation is not needed for the efficacy of ketamine therapies. And another general evaluation by Zarate and others in 2020 said effectively it's not necessary for an individual to dissociate with ketamine infusions in the treatment of mood disorders. And so effectively, the acute antidepressant effects are basically after a single ketamine infusion, really just associated with some other physiological outcomes and not the dissociation. Although for some people, the trip and the trippiness seems to be something that does other things for them. But the majority of people, it doesn't seem to have any impact whatsoever on their antidepressant results. So basically then, we can say that if you're coming in to get a ketamine infusion, there's no need to go extremely high in your dosing. Sometimes more is less. And that's kind of a key point because the more medication you get, sometimes you get more side effects, more nausea, more dizziness, more spaciness. And for some people, they get more anxious at these higher doses that really don't impact the bottom line. So you don't have to actually have a major trip. You don't have to feel like you went to outer space in order to say that ketamine therapies work. Ketamine therapy is highly effective. It's very safe. And the patients we generally see have suffered extremely long periods of time with their mental health conditions and have had no success with other treatments. Ketamine can make those medications work better. It can make the individual more functional, less depressed, and in a number of different wellness aspects also improve that as well.